There's so much chaos and uncertainty already with this administration and their policies. And what we are seeing now is just the negative impact that this reconciliation bill has. It's Medicaid cuts. You're hearing about that. It is, but there's so much to it. So I am so glad that we are having this conversation with all of you, because I think it helps as you ask questions about what is in it. We are able to talk to you real time so that you see what's going on. So I understand the question just came through from Pam on Facebook. And our question is, can we as people organize to show our opposition to this horrible bill? And absolutely, yes, that's the point here. This is about all Americans coming forward. This is your Congress. These are your elected representatives, and they are actually behind closed doors imposing and putting together policy that is going to harm the American public. So absolutely, this is the goal here, is to make sure that we're shining a light on what is happening so that all of you can use your voices, use your organization skills, and get out in your community and talk, whether you're reaching out to your congressional members or just making the rest of your community understanding what's at stake. Because, here's the thing, we've talked a lot about healthcare. There's so much in this. There's energy impacts on our clean energy for our future and clean water and clean air. There is, besides the healthcare impact to Medicaid, there's impact to Medicare, and there's a ripple effect. You don't have to be on Medicaid or have the Affordable Care Act. If you're just sitting home and you think, well, I'm not going to be impacted because I'm not on Medicaid, you will be impacted by these cuts. It's going to have a ripple effect, and it's going to increase premiums for individuals who have insurance. They are also potentially going to lose access to healthcare if a rural hospital closes because of these Medicaid cuts, or a hospital decides they're going to have to cut a maternity unit or somewhere to kind of address the challenges that they're seeing in these Medicaid cuts. So too many people are going to lose access to essential health care. So I have another question, and this is from Jessica Craven's audience member, Deb. And here's a question regarding Medicare. What services will have to be reduced to account for the $500 billion cutbacks, or will out-of-pocket costs increase? I'm looking for specifics as much as possible, because that's what will make people sit up and take notice. You're absolutely right. So as we are looking at the Medicare cuts, what we will see and what's going to happen are increases in out-of-pocket costs for seniors could be impacted. But we're also looking at the other things that seniors rely on. So think about it this way. We work so hard as Democrats to address Medicare cuts when we cap the cost of insulin for seniors, when we put more money in their pockets, when we actually required a prescription drug negotiation at the federal level for the first time so we can lower prescription drug costs. Now, what this $500 billion cutback does is really take away some of those savings at the end of the day. So at the end of the day, think about it in terms of what was given and what we fought for, and some of that is going to be taken back as well, along with out-of-pocket costs increase and other things that could happen for seniors when they rely on Medicare. So that's what's at stake. It's such a bigger and broader issue because we have worked so hard to bring those cuts and address Medicare and make sure seniors have the ability to access that preventative care or access the care that they need over the years. And all of that work we have done is going to be rolled back to pay for some of the cutbacks that we see. So that's the challenge for seniors. And let me talk about a couple of other things, because when I was home, I got a question with respect to one of our young Democrats, somebody who was on campus, college campus, asking in general, listen, not as a Democrat or Republican, as a college student, he wanted to know the impacts of this reconciliation bill to education. And let me see, it's going to be devastating. I'm here to tell you that. They want to cut back Pell Grants. They want to eliminate the options that you have right now to pay your student loans and go back to a time that you only have one ability to pay, and it's going to be a standard preset payment that you make. And if you have a hardship and you want to do it on income based, then you have to prove that. So they're going to eliminate the payment plans now and put it back to just the 2 payment plans. The other thing that they're going to do is roll back a rule that actually protected our active military from being scammed by predators in these for-profit schools. They're repealing that. So for-profit schools now can take advantage of some of our military when they're seeking access to these loans for their health care. So there's another question here from Lori on Facebook. So what is sequestration with regard to how Medicare cuts are being proposed? I'm going to make this very simple because most people don't understand sequestration, but it is a budgeting tool that requires certain things to kick in if the budget isn't done in a timely fashion. So very, very simple. And so what is happening now, because we're going through this reconciliation package and they're not doing the budgeting process in a timely fashion, sequestration kicks in, and this pay-as-you-go requirement kicks in, and it mandates under the law that Congress has to, for lack of a better word, balance this budget. And so it's mandating that if it is not addressed by Congress, that Medicare cuts will happen. It automatically happens in the law unless we specifically address it. So that's sequestration. There's a lot of tools and policies that are being addressed right now. And I think we're trying to make it as simple as possible so people understand the real life consequences of this legislation at the end of the day. We want to make it simple so people understand you're going to either lose your health care, your costs are going to be higher for you around your health care. It doesn't matter whether you have Medicare or not, you're still going to see higher costs because there's the ripple effect. And we haven't even talked about the impact on food assistance. So many Americans across the country, working people, seniors, veterans, children rely on food assistance, and they're cutting that as well. So there's a lot at stake, and we're just trying to get the information out there. And let me just finally say, you guys are key to all of this. Once you know about it, your voices and your organization around making your voices being heard are key so that we can knock out this bill, take out the toxic pieces of it, make sure that at the end of the day, the billionaire class, they do not get the tax cuts. They should be paying their fair share. This is the largest transfer of wealth in this country. This bill is the largest transfer of wealth from the poor and in the middle class, the working class, to the billionaire class. That's what this bill does. So Donald Trump's, that's his intent with this. And they're trying to hide it around language that really is not telling the truth about what's written in the legislation. And at the end of the day, if we don't fight as a country, if we don't talk about what's in it, and then stand up and demand that it not occur and demand the change and actually ensure that we as a country are fighting for our poor, fighting for our working class, we should have every advantage, just like the billionaire class, and they should not get all these breaks. That's what this is about.